just to give a little brief description on PRP to help them understand, those that are a little leery and kind of have questions about that.
Yeah, exactly. Okay, so yeah, so this, I will try to explain the PRP the best I can in about 1 to 2 minutes, so patient can have some, idea of how the PRP works. So basically, PRP is platelet-rich plasma, which is a growth factor from patient's own blood. So patient is not getting any medication, patient is not getting any foreign substance in their body, it's just their own growth factor. So the way PRP works is that a patient comes to our office, we apply some topical medication for some numbing, and then we also inject some lidocaine, so patient has no pain.
Comfortable.
Yeah, exactly.
Very comfortable.
Very comfortable. Okay. Then we draw some blood and we get about between 8 to 10
Yeah,
cc's.
about 8 to 10.
Yeah, so 8 to 10 cc's of PRP, and then we inject that PRP using a very specific technique. And I have developed my own protocol, and my protocols are, new grow. That is one of my, patent technology, where I'm using a very specific size needle, with a very specific depth, because I want to reach hair follicle exactly where they need to get the growth factors.
Okay.
Because if you use a longer needle or bigger needle, then we are kind of killing the purpose. People are not seeing the results. But after showing so many of these PRP treatments, and our results are
They're amazing.
So people with only one treatment, they have seen such a good results. So I do recommend that patient should get more than one treatment, since this is a natural way of treating, hair restoration or hair loss. Multiple treatments, such as at least 4 treatments between 4 to 6 weeks apart, would really help the patient, restore some good hair, and also.
And it maintains what they have existing.
Exactly.
Right?
Our goal is basically to provide the nutrition to the hair follicle. There are so many reasons for poor hair growth in men, and whatever the reasons are, as long as we can provide some fertilizer to the follicles, people are really seeing results. So.
And they're so happy at the end.
Exactly.
If the patient is about here for how long? About 40 minutes, right? From beginning to end?
The procedure, 40 to 45 minutes. That include, some initial paperwork, and then applying the lidocaine, and then the basic, 45 minutes, no downtime. They can go back to work. There's nothing, they can actually do it in their lunch break.
Yeah, that's great. Patients love to come in for lunch and then go back to work.
Yeah.
Well, thanks, Doc. So I'm going to come at you with our next segment, which will probably be PRF, to just explain the definition and the breakdown of that.
Yeah, exactly.
Okay?
And I will, at that time, we will have more segments where I will explain about A-cell, I will explain about amniotic growth factors.
Extracellular.
And we have some stem cells treatment, and we also have some multivitamin treatment.
And exosomes.
Exactly,
now,
exosomes and multivitamin. And finally, we also do hair transplants.
Of course.
So.
I mean, if you resort to the last resort.
Exactly.
All right. Thanks, Doc, so much.
You're welcome. Thank you.
All right.